Dr. Bill, good to be here with you tonight. We are going to talk about why chiropractic for kids and beyond that, how to have healthy kids. So, what are my qualifications? I have 6 kids and I have 12 grandkids. My kids are all adults now, and I've been able to help raise them from little teeny babies on up. And I've also done a lot of schooling and a lot of thinking about it. I've been adjusting and helping children now for 38 years. So I think I have some qualifications. I love kids, I always have. I'm going to tell you how it all began. So I'm going to give you a little an outline of what we're going to cover. So basically what we're going to talk about is kids, how they can be healthy, what role chiropractic can play with that, tell you how it all began for me. At the end of all this, we're going to show you a link to mothers that have come into our practice and who talk about their experiences with chiropractic and children as well. So hopefully it's going to be very rewarding. I'm going to go over some things that are really key and important, and we're going to do them one at a time. So here we go. Hold on, little baby. It all starts with babies. So the cool thing about babies is they're awesome, but the challenging thing is in order to get into the world, they have to be born, and to get born, lots of pressure on head and neck, and that's where it all begins. So when a baby is born, even though they're extremely flexible and their cranium, their head is actually very, very soft. They have a huge soft spot in the top and in the back. Above and beyond all that, they still have to get out through the vaginal canal, which helps them tremendously. By the way, C-section is not better, vaginal is. Unless you have to do an emergency C-section to have the baby born, then you have to do what you have to do. So basically, getting the baby born is awesome, and very, very gentle chiropractic adjustments, about as much pressure as me just barely touching this baby and holding here at the sacrum and here in the cranium. We do craniosacral therapy and help babies function better and work better and be happier and healthier. So we recommend checking babies from even day one. We've had several come in the last few weeks at 2 weeks old, 3 weeks old, 1 month old, 1 day old. And again, the whole technique with babies is very, very gentle. About as much pressure as just for me to hold this cute little thing up in the air, and that's it. And what we do with babies is check them just to see if they do have any misalignments or subluxations, because babies have spines too. They're not as big as this, but they definitely have spines as well, and they need to get checked as well, and we do that, and we very gently help to remove subluxations, help their little bodies work better. What are some key things that babies come in for? Well, number one is reflux. A lot of reflux going on. There's pressure on the sphincter between the esophagus and the stomach, and that makes that body not hold things down as well as they can. There's also the neurological connection between what's happening in the spine and what's happening in the organs of the body. So if there's not a good communication between the brain and the spinal cord and the spinal nerves, then that body's not working as well as it should. So when we work on a baby or a toddler or a child, we're not only focusing on what's happening here, but we're also focusing on how can we help that whole body communicate better. Where chiropractic began for me was I actually went to a workshop. It was done by the chiropractor my sister was working for at the time, and he worked on a baby with colic, little baby, and a 2-year-old with ear infections, and an older child with significant digestive issues. So I didn't know what the chiropractor was doing because I'd never been to one before, but he was doing very gentle things the baby seemed to like, the toddler liked, and the older child liked, and he was helping restore normal communication in the body so that it worked better. So I was hooked, changed my major, came out to BYU, I'm from Maine, and went to, in essence, pre-med stuff. Then I went off to, after that I went to chiropractic school in Davenport, Iowa, and the rest, as they say, is history. So that's why we see babies. What about kids? What is one of the most common things that happens to kids is they fall. Little toddlers, I've looked at different stats, and it's in the thousands of falls a year average. More than 50% of all babies fall on their head within the first year of life, according to stats that I looked at as well. So a lot of trauma going on here, not just physical, but can be chemical, emotional. And again, by helping to keep this as fine-tuned as possible, it's actually going to help that body function better. So another real key thing is we actually have noticed many times that when there has been a physical, emotional, or chemical trauma, that the body within 24 to 48 hours after that can actually significantly respond in a negative way. The nervous system's kind of freaked out, doesn't know, it responds in a way that the immune system kind of can crash. And a lot of times those kids will come in and they'll be sick all of a sudden, 24 to 48 hours after trauma. So that's why we have we see people on a regular basis. We have a lot of families that come in for wellness care. They get checked once a week, once every 2 weeks. And you're going to hear from some of them at the end of this video. We'll show you again that link on YouTube, Chiropractic for Kids and Families, and it's testimonies from our own patients that we did at our open house at the end of February. So you get to hear from others instead of from me. So toddlers, great time to be checked on a very regular basis, more than once. In fact, one of the testimonials you'll hear is a mother who said when she brought her son in, initially had some issues going on, but then after he started to get better, one time I checked him out and I said, so what happened to Michael? And she said, well, what do you mean? I don't know that anything happened to Michael. And he said, well, actually, Mom, yeah, I fell really hard on the playground. She didn't know that, but it was very obvious what was going on in his spine. So we did do something to help that. A jig with a good adjustment helped his body get back to more normal and function better, and therefore communication from the brain to the rest of the body was much better. Another thing I want to just share is this chart right here. It's the difference between parasympathetic and sympathetic nerve system, part of the autonomic nervous system. That's the chart I showed you earlier. Sympathetic is the fight or flight. So if I had to get out of this room fast, my adrenaline would kick in. My sympathetic fight or flight system would say, hey, let's put all the energy in your legs and your heart and your lungs and get out of here. That's a stress response. And it's awesome when you're under stress. Not so awesome when you're not under stress. So a lot of babies and even kids that come in here are stuck in the sympathetic mode, and they're not. The parasympathetic system is kind of shut down and not nearly as dominant as it should be to help with rest and digest. So parasympathetic says, okay, we need to help this person calm down, relax, digest better. Difference is the breathing slows, the heart rate slows, the body functions much better. So there needs to be a balance, and that's what chiropractic does. And that's what chiropractic does for children. So I want to talk about a couple other symptoms. What happens if your kid gets an ear infection? Well, the typical medical approach is you go in and you use antibiotics to try to get rid of the infection. If that doesn't work, you might go to a steroid, or you might put tubes in the ears. Our premise is always the power that made the body heals the body. How can we help that power function better? How can we help that nervous system be more in control of what's happening? So ear infections I've been treating for over 30 years, and we do a very natural approach. We check out the subluxation of the neck. The nerves are connected to what's going on in the head, including the ears, and we check sinus drainage. We teach parents how to do sinus drainage to help drain the sinuses here, and also here, eustachian tube drainage. We recommend a garlic olive oil kind of combination put inside the ear. There's a lot of wax. We tell you to put hydrogen peroxide in there first, help that come out. And then by helping the body in a natural way, get enough sleep, get enough liquids, I've seen, with very few exceptions, in thousands of cases, that the body's responded and been able to heal without antibiotics. So once upon a time I did the math, I can't remember now what I came up with, but 6 kids times 18, so if we said times 20 would be 120 years, so just take a little bit off of that. 110 years of having kids that I was responsible for, from ages 0 to 18, and we only had to use antibiotics one time, because we really believed that the power that made the body is the power that heals the body. How can we honor and respect that? And when we did that, it actually helped the body function better. So we talked about sinuses, we talked about ear infections, stomach stuff we already talked a little bit about. Again, helping establish that normal relationship. Instead of disease, we call it dis-ease. How can you reconnect the brain to the way the body functions? That's a state of ease. And the body then says, hey, you know what? I think that we ought to help this body function better. I've told my story before too, kind of goes along with the reflex one. Unbeknownst to me, you don't always know you have a subluxation, by the way. So if you're looking at this and wondering, well, how do I know if my kids have one? you won't know. You can get some cues if you look at their posture, if you look at if they seem to be stiff or not. But some kids even that do have subluxation seem to be amazingly flexible and active and so forth. But in my case, I had played a lot of sports, fallen out of some trees in Maine, had some help falling out of a garage from my brother, and I had a subluxation in the middle of my back, didn't know it was there. The only symptom I had that bothered me on a regular basis was heartburn or stomach acidity. So I did the typical stuff, took antacid tablets, went to a couple doctors. They said I could do a barium swallow of radioactive material, see what's going on. I said, I don't think I want to do that. So instead I did my thing, took my antacids, came back, got into chiropractic, decided to be checked, and sure enough, in the middle of my spine, there was a subluxation. Didn't feel it until the doctor touched it. When he did, I said, oh, I can feel that. And when that got adjusted, guess what happened? All of a sudden, communication from brain to my stomach improved, and all of a sudden, Bill Lawler no longer had any acidity in my stomach. Because all of a sudden, my stomach could actually talk to my brain, and it alleviated the problem because they communicated, and that took care of that. So, we obviously help people that have physical trauma, that have a stiff neck and have headaches, have lower back issues. Working out right now with a boy that has a bedwetting issue. Done that with hundreds and thousands of kids in the past as well. All the same premise. Help the body heal itself. Figure out how to get the brain communicating better with the body. And most all those times, the body's going to function better, hopefully to the point to getting rid of whatever the symptom is, and beyond that, to helping the body be actually as healthy as it can be. I wanted to share two more thoughts, and then I will end this short little video. And again, recommend that you look at the link that will be posted for the mothers and their testimonials. So now we're going to push the limits a little bit. What about if your kid gets a fever? Okay? Is that a good thing or a bad thing? Is it something you should freak out about, or you should be happy about? Think about that for a moment. Why would a body get a fever? If you're out camping and you need to purify water and you don't have a filter, you don't have little iodine tablets or whatever the little filtration tablets are, then one other option would be to heat up the water. It gets rid of the germs, helps the body, helps the water to purify itself and cleanse. Same thing in the body. The body raises that temperature because it wants to fight something off. Something is going on that it doesn't want to go on, and it will stop it. So, fever can be an amazingly good thing. I was in chiropractic school and they asked, okay, what temperature is too high? And that was it. I knew it was a good question, but I didn't know the answer. And the answer to me as a parent and grandparent and a doctor, a pediatric chiropractor, is what else is going on? Sometimes at 100 degrees, the kid looks terrible. They look lethargic. They look like they're not coping well. And other kids at 102, 102.5, and 103, they're still bouncing around and they've got lots of energy. So I don't think it's the degree as much as it is what